because these are new molecules, I'm going to be talking about synthetic cannabinoids. Acetone and chlorophone dilutants are used, and they are sprayed on dry herbal particles. It is more potent than cannabinoids, normal cannabinoids, and it is actually sold now illegally in Turkey through tobacco and nargile. Actually, it is used. Well, there are more than 150 synthetic cannabinoids which have been defined. GBH 210 analytic defined synthetic cannabinoids. There are important subgroups. Potent impact. It has got 90 times more potent than THS. It impacts like marijuana, and then negative effects increase. Well, it is cheap. That's why it is becoming widespread in our country. And toxicological routine tests actually do not detect it, that's why. And the legal follow-up patients in the urine or else toxicologically, it is not going to be it is tested, that's why it is not used. The legal audit actually is a problem for us. Mostly between 16 to 27 years of age they use it. And however, they think that the youngsters, it is less harmful than marijuana. That's why they use it more comfortably. Bonsai, Jamaica, these are the names, the different varieties which are used in Turkey. For instance, bonsai in Turkey, in the United States, and spice in Canada. How is it used? It impacts on similar receptors, CB1 and CB2 receptors. They impact the brain, spinal cord, and peripheric nerve system. CB1, especially mood changes, pain perception, stimulant situation, and body temperature and cardiovascular regulation. It increases the appetite as well. At CB1, CB2 has an impact on immune modulator, especially in the cardiac system, which I'm going to mention. The parasympathetic impact is more. Synthetic cannabinoids compared to tetracannabinol, they are more potent. Approximately 90 times more. So what are the acute impact of synthetic cannabinoids? There are approximately 50 impact. Tachycardia is seen the most. This is the most frequently. Nausea, somnolence, mydriasis, mild hypokalemi, paleness in the skin, hypertension, agitation, disorientation, visual hallucinations, and diplopia. Well, epilepsy, manic shifters. So what happens? Like sudden death, for instance, in the long-term effects, acute liver failures, also in the synthetic cannabinoids. Well, actually in Marash, there are 3 patients who had sudden death. And they say that we only live once, and live like this is it was the advertisement when it was first emerged, when it was first launched out. And then in 2008, actually, in different countries of the world, in Australia and other countries, actually, it started to be banned around the world. Psychotic disorders, paranoid seizures. There are also some. These are other adverse effects. And when we look at autopsy results, pulmonary edema was detected with the ones who lost their lives. There wasn't much study in this area. I searched literature. I did a study actually. The case reports and the studies carried out. They are indicated here. A study in Istanbul, Erenköy and Marmara partnership study. Free-wheel dispersion and P-wave dispersion checked. It's technical, but it is easy to understand. P-wave, minimum value difference, time difference was measured. Atrial repolarization, non-invasive method it is. 60 cardiovascular risk markers were used. In the P distribution, depression, panic disorders, and other psychiatric disorders, it was associated according to the study. And the study that I mentioned, the PD values, were significantly high. And it was correlated with the dependency profile index. It was over 40 ms, the PD values. The synthetic cannabinoids to lead to rhythm abnormalities, according to the study. Synthetic cannabinoids using young adults. Tachycardia is seen, and in marijuana, tetrahydrocannabinol is used. In the low and mid dose, it triggers tachycardia. For that reason, increased cotamolin and tachycardia, proaptic abnormalities they can lead to, and they can also increase myocardial oxygen needs. For that reason, tetracannabinol, the high dosage synthetic cannabinoid usage, it increases parasympathetic activity, high hypotension, and bradycardia. Parasympathetic activity and sympathetic activity somehow to come into scene. And hypotension and epicardy, they lead to myocardial risk, especially in the adolescent group usage. Myocardial risk, it leads to chest pain, as you know, but these patients, we have to be cautious. Some QT values. Prolonged QT values. Prolonged QT is a very non-specific result because such patients, they come to hospital with agitation, and most probably they are treated with antipsychotics. This is hydrochlorperidone mostly, and on its own, it prolongs QT. So prolonged QT values are not that specific for this group. There are MI cases, Shell et al., 7 MIs. And the MIs, ST elevation, you see, and due to synthetic cannabinoid usage. ST elevation, MI. Anterolateral ST elevation, MI, you see. Lateral axe, ST straightening, inferior axe, T inversion. D2, 3, and T inversions, you see. And in the lateral axis, D1, V2, and in V3, you see STB straightening. There are more severe effects, of course, not only mild. A second level AV block can be seen. Again, you see here. And in the thoracic point, ventricular tachycardia and severe arrhythmia side effects can also be seen. Synthetic cannabinoids do have such an impact. For us, it was significant. And I work in Ahmet Polyclinic. In emergency service, there are many cases which come. And they are young adults actually, which we don't know the real reason. They've got unexplained agitation and cardiovascular symptoms, especially tachycardia. And after a certain number, we detected that after using synthetic cannabinoids, they come to emergency unit. And the tests, examinations also approved this with unexplained agitation, with where there are cardiovascular symptoms are prominent. Synthetic cannabinoid intoxication should be taken into account. Why should clinicians be cautious? Because synthetic cannabinoids, they prolong QTG, and because they've got an extensive usage with simple transmission disorders, dorsal deposit. These are serious dysrhythmia, and it is simple. It can be found everywhere. It is not invasive, and ECG, this is a method. So ECG, ECG can be used in order to detect these patients, whether they use synthetic cannabinoids or not, and if they've used, where does the clinic go to? Thank you very much.